to light the way. Making nursing stupid simple every day.
Imagine your patient can't stop moving. Their arms jerk out without warning. They can't control it, and it's only going to get worse. Because they were born with this. That's Huntington disease. And today, we're making it stupid simple. Here's the one thing I need you to remember. Huntington disease is a genetic disorder that slowly destroys brain cells. It causes uncontrolled movements, thinking problems, and mood changes. And it gets worse over time. That's the rule. It's caused by a mutation on chromosome 4. You inherit it from a parent. If your parent has Huntington disease, you have a 50% chance of getting it too. That's called autosomal dominant inheritance. You can't prevent it. You're either born with the gene or you're not. Symptoms fall into 3 categories. Let's take them one at a time. First, movement. Patients develop jerky, uncontrolled movements. We call this chorea. They can't stop it. But here's what's important. They are awake and aware the whole time. Chorea is not a seizure. Second, thinking. Memory problems, trouble focusing, slowed thinking. Third, mood. Depression, irritability, anxiety. Symptoms usually begin between the ages of 30 and 50. As a nurse, your 2 biggest concerns are safety and swallowing. Let's start with safety. The chorea causes falls. Those uncontrolled movements can throw your patient off balance at any time. Pad the side rails. Non-slip socks. Assist them with walking. Never leave them alone when they're up. Now swallowing. As the disease progresses, the throat muscles stop working properly. That creates a serious aspiration risk. Always position your patient fully upright. Head of bed at 90 degrees before any meal. Thickened liquids, small bites, and always stay close. There is no cure for Huntington disease. All treatment is about managing symptoms. A medication called tetrabenazine can reduce the chorea, the movements. It does not stop the disease. Speech therapy helps with swallowing. Physical therapy helps with movement. The goal is quality of life. Here is the #1 mistake students make on NCLEX. They see uncontrolled movements and they think seizure, so they choose seizure precautions. Wrong answer. Chorea is not a seizure. The patient is awake and aware. The correct priority is always fall prevention. Padded side rails, non-slip socks, assisted movement. Don't get tricked. Quick test. A nurse is caring for a client with Huntington disease at lunch. The client is coughing after every bite. What is the priority nursing action? Pause the video. Think about it. The answer? Stop the meal and assess swallowing. Coughing after every bite means aspiration risk. That's an airway concern. Always your top priority. Stop the meal. Sit them fully upright. Assess. Notify the provider. Now that we've made Huntington disease stupid simple, it's time to think like a nurse.
Quick recap. What is Huntington disease? It's a genetic brain disease that destroys neurons. It's progressive and has no cure. What causes it? A mutation on chromosome 4. It's inherited in an autosomal dominant pattern, meaning there's a 50% chance it can be passed to a child. What are the symptoms? Think of Huntington disease as affecting 3 major areas: movement, thinking, and mood. Patients often develop chorea, which are jerky, uncontrolled movements. They may also experience cognitive decline, memory problems, difficulty concentrating, and changes in judgment. Mood changes are common too, including depression, irritability, anxiety, and mood swings. What are the nursing priorities? For NCLEX, think safety first. These patients are at high risk for falls because of their uncontrolled movements and poor coordination. Next, think aspiration precautions. Swallowing becomes more difficult as the disease progresses, which increases the risk for choking and aspiration. Finally, focus on nutrition and hydration, since patients may have difficulty eating and maintaining their weight. How is Huntington disease treated? There is currently no cure, so treatment focuses on managing symptoms and improving quality of life. Tetrabenazine may be used to reduce chorea, antidepressants can help with mood symptoms, and therapies such as speech therapy and physical therapy can help patients maintain function for as long as possible. Remember, these treatments help manage symptoms, but they do not stop the progression of the disease. Memory trick. Think of the word hunt. Patients are hunted by 4 problems. H, hyperkinesia, chorea, uncontrolled movement. U, unstable, fall risk, safety first. N, nutrition risk, aspiration, swallowing problems, and T, thinking changes, cognitive decline. NCLEX trap. Uncontrolled movements on NCLEX make students think seizure. They choose seizure precautions, padded tongue blade, oxygen ready, but that's the wrong answer. Chorea is not a seizure. The patient is conscious throughout. The correct priority is fall prevention, padded side rails, non-slip footwear, and to assist with ambulation. Okay, pop quiz. A client diagnosed with Huntington disease is admitted after a fall at home. The client's family asks the nurse, "Can we test our kids to see if they have the gene too?" What is the nurse's best response? A. Your children cannot be tested until symptoms appear. B. Genetic testing is available, and I can connect you with a genetic counselor. C. Only children over 18 can be tested, and it is a personal decision. D. Testing is only done after a parent is diagnosed at autopsy. Pause the video if you need time to think. Answer is C. Predictive genetic testing for Huntington disease is not recommended for minors because they cannot provide fully informed consent for life-altering information. Testing is generally deferred until adulthood when the individual can make that decision for themselves. Genetic counseling is strongly recommended before any testing occurs. A is incorrect because predictive genetic testing for Huntington disease is available before symptoms appear. This response gives the family incorrect information and could delay important counseling. B is incorrect. This response is partially accurate. Genetic testing is available, and a genetic counselor referral is appropriate. However, it misses the critical detail that testing is generally not recommended for minors. Offering testing without addressing the age and consent issue is an incomplete and potentially harmful response. D is incorrect because genetic testing does not require autopsy confirmation. Predictive testing is available through blood test for at-risk family members during the parent's lifetime. All right, future nurses, so how did you do with today's lesson? If you felt stuck on a topic, don't stress. That's how you learn. Nursing school is all about repetition, practice, and building confidence one step at a time. Don't forget to grab your free cheat sheet linked below to help you review today's lesson. And if you want extra NCLEX-style practice questions, bonus rationales, memory tricks, and extended study sessions, check out my Patreon linked in the description for even more no BS nursing content. Make sure you like, subscribe, and turn on notifications so you never miss another stupid simple lesson. All right, future nurses, you've got this, and I'll see you in the next one.